Hi, I'm Jay McCallum with Core Balance Therapy, and today I want to talk to you a little bit about gluteal training. In our last video, Amy talked to you some about IT band pain and tightness and mentioned that one thing that we often like to do with patients who have that is to do some gluteal training and try to get the hip a little bit stronger. And really that's something we end up doing for a lot of conditions. It's the biggest, most powerful joint in the body. It's a place that we would like to see patients be able to generate more force from, and building a stronger hip seems to benefit a great many conditions: back pain, hip pain, knee, ankle, foot. It's just a great place to spend time. So let me just run through some exercises I think are often very useful for patients. I'm going to start with a real simple isometric, just a wall isometric. So I just position folks up against the wall, bring one knee up and out, and I'm just pushing into the wall. And the idea, I have to keep my body vertical and I keep pressure out, and I feel both sides working. It's a great work for both hips. And a nice long hold, like a 30-second hold, works really well with this exercise. So isometrics at the wall are a really good starting place for challenging the hip. Another one is a simple single leg squat, which sounds scary, but you can just get on a leg, settle yourself, sink and push, and try to be aware of not allowing your knee to buckle in, and keeping square over your body and not falling over by looking all over the place. So this sort of thing, up and down, nice and square, feeling that hard work through there. A similar movement is a step up. Modify the level of difficulty by where you put your foot on the step. So if I have my foot on a lower step and I'm leaning forward and pushing the step away, that's a bit easier. I can just make it harder with a higher step. And of course, harder still by holding weight in the opposite hand, which would load this hip more. So, getting down on the floor, side planks are a really nice way to train the outside of the hip. And there's a nice whole series of side planks we can do. We can start with just a simple bent knee side plank, which is a little bit easier. You can move out to a side plank with a leg lift. And then extending the knees increases the load considerably. Extending the knees and raising the leg and bringing it back down, which is hard. I just reserve for patients that I'm trying to prove they can exercise hard with just their body weight. So, so side planks, band resisted sideways walking is another wonderful hip exercise. And this band closer is a little easier. Further down the leg I put it, the more lever arm I have to control, the harder it is. A little bit of a bend. And I just want to take side steps without allowing a lean. So it's a step, not a step. Okay, last thing I want to show you is a fun variation on a old exercise that many people will have seen. A lot of folks will have seen just a side-lying leg raise. Challenge with these is that it's easy to let the leg drift forward. So we can correct that by positioning people, as I challenge my camera person, with their foot against the ball, and then rolling the ball up and down the wall makes me keep my foot back and is really hard. Balls will be used because we've got them in the clinic. You can use anything that rolls or slides. I saw a wonderful video of someone doing this with their child's toy truck, which would be really hard. But I want to come up and I don't want to allow my pelvis to lift. Just lift straight up. Really challenging exercise for the glutes. So, as always, if you struggle with any of these, or if you find that you're hurting when you try to do them, please give us a call. But I hope you enjoyed this, and we'll talk to you again next week.